Hello, my name is Dr. Yohan Samarasinghe. I am a consultant in acute and internal medicine and specialize in diabetes and clinical pharmacology. So clinical pharmacology is a posh way of saying vascular medicine, which means I look after people with blood pressure and problems with their cholesterol and other fats in their blood as well. So I guess this is a question people get asked at medical school. Why did you want to become a doctor? And I think I probably said at that time that I wanted to generally help people. I felt it was a very stable career and profession, which as you remained in it, you became more experienced and professionalized and more respected. But also I think I said in medical school, I could take it abroad if I wanted to. It's a universal subject, so wherever you go, you can practice medicine. It's probably not something I've actually ever done, but when you go abroad and you tell people you're a doctor, then I think one, they respect you, but two, I think they also feel that they can ask you questions about medical problems, which is often quite nice. Why did I specialize in diabetes? By chance, more than anything. I was in a job as a registrar, in a medical job, a general internal medical job, and my boss at the time was a diabetologist. And it was a lovely hospital in London, and the team were great, and I just enjoyed the whole situation, and I enjoyed practicing diabetes at that time, and I was encouraged to write papers and participate in research, I guess that sort of enthralled me, and the field, the more you get into a field, people get more and more excited about it. I walked into it initially not thinking I was going to go into it, but was persuaded by the team more than anything at the time. I think the most rewarding part is being with people all the time, and being with new people, seeing new people, hearing new stories, and having that patient contact. For me, having patient contact is wonderful because you get feedback from people. Most of the time I'm hoping it's positive. Occasionally it's a little bit negative, but even that is a learning experience. I think the other thing I find very rewarding is I like to think of us as general physicians as the house of medicine. So in the program house, he's a doctor in a hospital who's looking for the underlying problem. He's hunting for the clues in the patient's history and with the investigations. And that's what we do. And that's wonderful to try and be that Sherlock Holmes and try and find what's we're dealing with and what the underlying problem is. And medicine is exactly like that. It's a complex field, and no one person is the same. And that's why people can present in very different ways. And I guess that's what I find most rewarding.